Okay, so to continue our topic about clinical pharmacology of hematology, clinical therapeutic, the second session will be about the antiplatelets here. We are going to focus on the aspirin. We are going to speak about Clopidogrel, Blavix, and other agents belong to the antiplatelets and with the clinical application. I am Dr. Khalid Hassan, a professor of clinical pharmacology and clinical research. Okay, let's get started about antiplatelet drugs. Okay, number one, we have aspirin. We ask about aspirin mechanism of action for as antiplatelet effect. How aspirin produce antiplatelet effect? As you can see here, aspirin irreversibly inhibit COX-1. This will lead to the decreased thromboxane A2, and as a result, this will shift the balance towards prostacyclin. And prostacyclin responsible for decreasing platelet aggregation. Therefore, aspirin used for the secondary prevention, post myocardial infarction, stroke, TIA, and PAD, peripheral artery disease. List of medication belong to the P2Y12 inhibitor. We looking for this medication, list of medication. How this medication work? MOA, mechanism of action. Clopidogrel, Prasugrel, Ticagrelor, Ganiglerol, Teclopidine. These group of medication belong to the inhibitory of P12Y2 by binding to the ADP. ADP stand for adenosine diphosphate. Okay, by inhibit adenosine diphosphate ADP, this will prevent a glycoprotein 2B3A activation, and the end result will be decreased fibrinogen bridging. Clopidogrel mechanism of action, Clopidogrel pharmacokinetic caveat here. Clopidogrel considered like prodrug that need activation by specific type of cytochrome. This cytochrome called cytochrome 2C19. When the patient take another medication for peptic ulcer disease, for example, such as omeprazole or esomeprazole, these two medication reduce or inhibit cytochrome 2C19, and the result will be decreased effect of decreased activation of clopidogrel, and there is a risk of clotting or like thromboembolic events. This is the case number one. Case number two, we can see this situation in patient with the considered like a genetic poor metabolizer. That means they don't have enough activity of cytochrome 2C19. Therefore, the patient may suffer from a thromboembolic event. Okay, glycoprotein 2B3A, GB here meaning glycoprotein 2B3A inhibitors. Here we talk about name, route of administration, and uses. What we have here, three medication belong to this group: Abciximab, Eptifibatide, Tirofiban. Three medication. I will repeat it: Abciximab, Eptifibatide, Tirofiban. This medication prescribed IV during the BCI, percutaneous coronary intervention, during acute coronary syndrome, ACS. This medication blocks the final pathway by preventing fibrinogen binding to the glycoprotein 2B3A receptor. Dipyridamole and Cilostazol. What is a core point here? Dipyridamole, Cilostazol. Both of them considered like antiplatelets, increase the platelet cyclic MB via phosphodiesterase, and present anti-aggregation. The Dipyridamole, normally we use it with the aspirin for stroke prevention, for valve adjunct treatment. However, Cilostazol used for intermittent claudication. Okay, so we finished the antiplatelet. We move to the anticoagulant next. Okay, we finished the like brief flashcard of antiplatelet, and we covered the main maybe antiplatelet. We spoke about aspirin, clopidogrel, prasugrel, Abciximab, Dipyridamole, Cilostazol, and the clinical use, mechanism of action. So the third session, final session, will be anticoagulants and fibrinolytic. Thank you so much, and stay tuned.